Imagine a 78-year-old walking into a doctor's office for a checkup. Their blood pressure is a bit high, so the doctor prescribes a medication, maybe two. Within months, that pressure comes down to a pristine 120/80. The doctor is thrilled. The chart gets a gold star, and it looks like a total success. But later that night, they get out of bed to go to the bathroom. Within seconds, their brain loses adequate blood flow. The room spins, they reach for the wall, miss, and suffer a fractured hip. To understand why this happens so frequently, researchers tracked over 15,000 seniors for 5 years. The findings were published in JAMA Internal Medicine, and they directly contradict decades of universal medical advice. This chart compares mortality and fall risk across different blood pressure groups in the study. The data reveals that seniors who achieved that textbook pressure below 120 experienced a 28% spike in risk for serious falls requiring hospitalization, along with a 14% higher overall mortality rate compared to those in a moderately higher range. For adults over 75, that 120/80 reading becomes an active hazard. Pushing pressure that low completely ignores the physical mechanics of how an aging body fights gravity to keep a person standing. Looking at this diagram of the body's fluid dynamics, we see exactly what happens when you move from sitting to standing. Gravity instantly pulls your blood downward, pulling it in your lower legs and immediately drawing it away from your brain. A young, healthy cardiovascular system handles this easily because the arteries are flexible, expanding and contracting to constantly maintain flow. But through a process called arteriosclerosis, aging vessels become rigid. They lose their elasticity, acting less like flexible tubing and more like a sun-baked garden hose. Because those stiff pipes can't expand, the body strictly requires a higher baseline pressure just to generate enough force to push blood upward against gravity. When heavy medications aggressively drop an older adult's blood pressure to younger textbook levels, you take away the exact mechanical thrust their stiff arteries rely on to keep them upright and conscious. The hardware isn't the only thing changing. Your blood vessels contain tiny pressure monitors called baroreceptors. When you stand, they normally detect gravity's pull in milliseconds and signal your heart to pump harder. In older adults, these sensors lag. They respond slowly, missing that window to command the heart to catch up with the downward shift of blood. Compounding the problem, aging kidneys and livers process drugs much slower. A standard dose of a blood pressure medication lingers in the bloodstream, actively suppressing the heart precisely when it needs to speed up. This graph maps out orthostatic hypotension, which is the direct result of stiff pipes, lagging sensors, and lingering drugs. You can see the stable reading take a sudden plunge into the danger zone, the exact moment the person stands up. A perfect reading taken while sitting quietly in an exam chair creates a dangerous illusion. It hides the fact that the brain is being starved of oxygen every single time that patient gets up from the dinner table. This infographic outlines the evidence-based systolic targets that maximize longevity. For adults 65 to 74, 130 to 140 is optimal. From 75 to 84, it climbs to 135 to 145, and for 85 and older, 140 to 150 keeps the brain fully supplied. Standard 15-minute doctor visits rarely test for gravity-induced drops. The only reliable way to uncover your actual fall risk is a 3-minute diagnostic test you can do at home. First, lie completely flat on a bed or couch for 5 full minutes. Check your pressure while still lying down to establish an absolute baseline, and write those numbers down. Next, stand up. Do not wait for your body to adjust. Check your pressure again immediately to capture how your system reacts to gravity. Compare the readings on these two monitors. If your top, systolic number, drops by more than 20 points, or your bottom, diastolic number, drops by more than 10 points upon standing, your medications are likely too aggressive. Applying a single target to every human being ignores the mechanical realities of the aging body. By bringing these specific standing measurements to your doctor, you can step away from static universal charts and start managing your health based on how you actually move through the world.